we can talk about are the mosquito-borne diseases again, which flare up during this time of the year in the tropics, particularly in Mumbai. You know what I'm talking about. We are talking about malaria and dengue and so on. You have to be careful that malaria, there are two common species of the plasmodium which are known to infect in India, the Plasmodium falciparum, which is a dangerous one, and the Plasmodium vivax, which may not be so dangerous but comes with a lot of morbidity and can cause a lot of damage and prolonged hospitalization. It is characterized by high fever, headache, chills or rigors, vomiting, discomfort, and with falciparum we got to be careful. It can infect the whole body. It can lead to involvement of the brain, where we call it as cerebral malaria, and it can lead to jaundice, it can lead to kidney failure and a prolonged hospitalization in the ICU. Rarely it can cause death. So that is the alarm from malaria. Dengue, yes, it is again a mosquito-borne viral disease, and just like malaria is transmitted by the female Anopheles mosquito, dengue is transmitted by the bite of the Aedes aegypti. Now, the Anopheles usually bites in the early hours of the morning and late in the evening during darker hours, but the Aedes aegypti bites during the day that transmits the dengue virus. Dengue again is characterized by high fever, chills, headache, body ache, severe muscle and bone pain. Therefore, it is sometimes called as breakbone fever. Remember, it can lead to loss of your platelets, which are a component of the cells of the blood which are involved with blood clotting, and reduced number of these platelets could mean risk of serious internal bleeding and threat to life. And one more important thing, dengue has no treatment. All we have is supportive, like we take care of the fever, we take care of the fluids, we take care of the dropping platelets and so on, but no specific antiviral for the dengue virus. And that is very important, why we talk so strongly about prevention. And two more things that I need to share with you, which I've researched after 2006. Number one is chikungunya, again transmitted by the Aedes aegypti mosquito as well as by the Aedes albopictus. It is again characterized by fever, headache, muscle pain, myalgia, a lot of joint pains. That is chikungunya. And the next one you people have heard about recently is the Zika virus, originally discovered in 1947 in Uganda, and then as we all know that as the Aedes aegypti is becoming a global mosquito due to travel and shipments and air travel and so on and so forth, it is becoming common across the globe. This again is characterized by high fever, headache, body ache, muscle pain called as myalgia and so on and so forth. So you must have now realized that clinically, taking the symptoms, we really cannot distinguish between malaria and dengue and Zika virus or chikungunya virus, and therefore testing becomes mandatory. We sample blood. For malaria diagnosis, we have to take the thick smear and antigen testing. For dengue, we got to take the blood sample and do the IgM, IgG as well as the NS1 antigen testing, and similarly serological or antibody testing for the chikungunya and the Zika virus, along with the plaque reduction and neutralization tests, which are not commonly available, but they are the gold standard test for diagnosis. For all of these three large viral infections, dengue, chikungunya and malaria, remember there is no treatment. And one more concern with the Zika virus is in pregnancy. If pregnant women have had it, they carry a very high risk of having malformed babies, and no treatment for that. So what is the take-home message? Prevention is the take-home message. We can use mosquito repellent coils, we can use creams, we can use physical barriers like mosquito nets to prevent these infections, and that is our take-home message.